Yeah. Welcome. We're pleased to be holding the Dietetics Advisory Council again virtually during these COVID times. At this time, we will take attendance. Judy Nagy.
Here.
Susan Fenn.
Here.
Ashley Pax.
Here.
David Ryerson.
Here.
Mary John Luby, who may be joining us late. Carmen Clutter.
Here.
And Kathy Shalita.
I'm here.
I'm hoping that everyone has had a chance to look at the minutes from the last meeting, and could I get a motion to approve this?
I so move. Susan. I second the motion.
Okay. Then the meeting minutes are approved from the last meeting. I don't know if you can see, hopefully on your screen, but we have a new face, and that is Chelsea Wonsky. And Chelsea is the new legislative director for the State Medical Board. So she will be working with me and also with Sierra, who does our stakeholder and stuff, and will also be doing some lobbying as well. Chelsea, do you want to introduce yourself and just talk a little bit about your history?
Sure. Thank you. Hello, everyone. And it's nice to meet you. Thanks for allowing me to be a part of the meeting today. I started with the State Medical Board last month, and so far every day has been something new and different and exciting or interesting at the very least. Prior to joining the team here, I worked as a policy analyst at the Department of Insurance for 3.5 years, and I was at the Industrial Commission for 2 years prior to that. I actually grew up in St. Clairsville, Ohio, and I'm a proud graduate of Ohio University. So again, I'm happy to be here, and I'll give the legislative update here in a few moments, I think.
Yeah, you can go ahead and do that now if you want to, unless anyone has questions for Chelsea.
All right, then I'll go straight into it. We have 2 bills that are at the top of our list of priorities currently. House Bill 679, which impacts telehealth, and Senate Bill 246 around occupational licensing. As some of you are aware, the medical board created an ad hoc telehealth committee to address the board's approach to the legislation. The bill has passed out of the House and was introduced in the Senate, but has not been yet assigned to a committee. The ad hoc committee also continues to look to address other concerns regarding the practice of telehealth and telemedicine as it continues to expand in the state. We have drafted proposed changes to the language with our legal team around initial visits, consistency and standard of care, medical board rulemaking authority, and synchronous technology. Like I said, the legal team has drafted those proposed changes, and they are going to be reviewed at the next ad hoc committee meeting. As far as Senate Bill 246, the policy team has been working with the bill sponsors to address our concern that the ability of the board to adequately review out-of-state applicants was sort of diminished in the original bill language. So we have proposed changes to the bill sponsors, and the proposals are currently with the LSC and are being drafted. So we're just waiting to get those back for review, and then hopefully they'll be submitted to amend that bill. And that concludes the legislative update. Did anyone have any questions? Great.
Telehealth is, obviously a concern and has been in the past and will be continuing, but especially around COVID and the fact that so many of the services that all of our licensees have been providing or we're figuring out how to do that by telehealth and what we need to do going forward. So if you have a chance and if you want to listen to any of the medical board tomorrow, it's going to be like an 8-hour day, but there are different committees, and if you wanted to listen to the telehealth committee tomorrow, that might be something you might be interested in. We are going to start looking at across all of the advisory councils, looking at the frequently asked questions that we have on our website and going through those and making sure that all of the questions that are on there and all the answers pertain to the rules that have to do with dietetics and also the Ohio Revised Code. And we'll do kind of a draft of those, and we'll bring those before you during our next meeting for your input so that you can make sure that we're getting it right, see what we've missed for your licensees. And we would appreciate your help with that. And we'll try to get that to you ahead of time so that when we have the meeting, you'll already have some idea of changes that need to be made to that or have some input also. Anybody have anything to say about that or any other questions about anything so far? Kay, MAPCO. Kay, are you ready to give an update? You're on mute. Okay.
Kay, I think you're muted, Kay.
Thank you. Well, for some reason, we still can't hear you.
Hey, Jill, it's Paul. I'm texting Kay to let her know.
Thanks, Paul. I'll also say while we're waiting for Kay, I think all this that's something from Mary John right before we started this meeting, and she had some really good comments and I think questions and concerns about our annual report and where dietitians are listed in there and the different licenses, and also just how the occupations how many there are in different rural areas and metro areas. And so for the next meeting, I will make sure that I get some answers to those and make sure that we also have the right people on the meeting, so that we'll see if we can get Joe Turek, who's the head of our licensing, on here too to answer any questions. Okay, if we can't get you on, then maybe what we will do is have you email your updates. And Paul, if you could let her know that.
Yeah, or another alternative is we do have the option of calling in. So you can call into the meeting.
She has the number. Paul, does she have the number to dial in?
Yeah, I'm texting. I was.
Thank
Yeah,
you.
I just tried to call her. That's why you didn't hear me. But I'll text her the number. But she didn't reply to the text. So
Now can you hear me?
Hold up. Yeah. Oh, there she is. Hi, Kay.
Oh, thank you. Sorry about that. I was showing, my microphone was showing up green, and I tested my mic and it looked like it was supposed to work. So I'm sorry about that. Okay. OEND just wanted to let you know that as far as our attempts to try to get diet order writing included in the practice of dietetics, the Ohio Academy has drafted an amendment that would permit dietitians who are credentialed by hospitals and other health facilities. Can you hear me?
Yes.
And are authorized to enter into consult agreements with physicians. We've actually taken a different approach. Our previous approach was just to change our scope of practice, but we got a little bit of pushback about that from OSMA. So they suggested that we take the approach that pharmacists and nurse practitioners and PAs have used to enter into consult agreements with physicians to have these additional privileges. So we've got a draft of the amendment. We are working with Senator Hackett in the Senate and Dr. Liston in the House. And we've got the draft and once we hear back from them, we'll try to get it through Senator Hackett's office onto the agenda and hopefully get it attached to some piece of legislation and moving in the fall. So I know we've indicated to the council in the past that we've been working on amendments, but this is just to let you know that we've changed our approach in response to concerns by OSMA. And we're hoping that the Dietetics Advisory Council and eventually the board will be in support of that. We feel it's important for dietitians to be able to write diet orders, to be able to write TPN orders, and many other states, more than half of states in the country have this authority, and we're still trying to get that. We've been working on it for a number of years, and hopefully we can get something going on that. Any questions about that? Okay, if not, I just wanted to also let you know that we have gotten some questions about board-related activities, and I just wanted to let you know, and it might be, these questions might be appropriate to consider when you're reviewing the FAQs and the guidelines. You know, oftentimes the association gets called about issues that really the board ought to be interpreting, but because we're the association, you know, they'll contact us. Of course, because of the emergency orders for the pandemic, there were a number of questions that the association was getting regarding the additional practice abilities with telecommunications and telehealth. So, you know, we got a number of questions about that, but we've also gotten some questions about whether it's appropriate for certified dietary managers to sign the MDS documentation in nursing home and assisted living facilities. I think this is a lot. I think a main push behind this is pressure because these facilities are really having fiscal difficulties with all this, and they're really trying to push the services down to the lowest level of practitioner. So they're trying to get CDMs to practice dietetics. And by, they say, signing the MDS, what they're really doing is the practice of dietetics, because the MDS includes assessments, it includes care planning and that type of thing. So wanted to let you know that that's a concern out there, and that might be something that might be important to add into the FAQs in the future, or at least have the board's staff aware of this issue and how to answer those questions when they get it. When we get these questions, I try to refer these folks to the board for their answers too. Another kind of question we've been getting is about out-of-state practice. The telehealth executive order, and you know, the way it's written, it refers to, it says that dietitians, according to Chapter 47, as defined in Chapter 4759, can do the practice of telehealth, et cetera, et cetera. So I would think that implies that you have to be licensed according to 4759. But when folks from other states look at that executive order and try to interpret it for themselves, they're having difficulty with that. So I think that's another thing that the board probably needs to be aware of, and that we've gotten a couple of questions about. Also, just to let you know that because of all these provisions with telehealth, OAND did post on our website information about House Bill 197, especially about the provision allowing licensed dietitians to be able to renew their licenses up until December 1st. So we've been trying to keep communications related to that open and posted on our website. Looking at the other thing, that's another thing too. The other thing I wanted to let you know too is that the Academy is, we're not meeting because of all the concerns with the COVID-19, but we are offering various meetings online and having information out. So if there's information that the board wants us to share with our members that's related to licensure, we're certainly happy to do that. And I guess that's all, unless you all have any questions for me.
Yeah.
We are going to have our policy day. One of those telehealth meetings, webinar meetings, is going to be our policy day that we usually hold in the fall. It's going to be October 7th. Okay, thank you.
Okay, thank you so much for updating us on the activities, especially on the association.
Sure.
And as well, of course, anytime if you get any questions, we're happy from anyone. If you refer them to our contact box, I was having this conversation with Sierra earlier today. That really is the quickest and most concise way to make sure that we get an answer to someone, and we're always happy to do so. Or, of course, you can always email us directly.
Right. Okay, doke.
Thanks. Mary John, I did say this earlier that I really appreciated the thoughts and concerns that we got from you after looking at our annual report, and that's something that we'll make sure that we have Joe Turek, who's ever our licensing, here for the next meeting, and we'll take a look at these and make sure we have some answers for you before the next meeting.
Thank you for that. I feel like there's some really good opportunities for collaborating with other professions that are part of the medical board. So thanks so much.
Yeah, that'll be great. And thank you for reading it so thoroughly and getting questions and concerns back to us. Is there anything else for the good of the advisory council? We'll hold our next meeting in October. We haven't got the date yet, but I will make sure we get that to you, as well as some resources around the FAQs and ahead of time for you to take a look at so that you can have input, and as well as the questions and concerns member Mary John Rudy had. If that's all, then we're adjourned. Thank you so much. Stay well.
Thank you. Bye-bye now.
Bye-bye.
Thanks, everyone. Bye.